Hello and welcome everyone. My name is Candice Sering. I am a New York State Nurses Association representative at Montefiore Hospital, which is one of New York City's large private hospitals located in the Bronx, which actually ranks at the bottom health indicators of New York State. So we run a pretty fierce shop where we defend our community pretty hard. So I'm happy to be here to moderate this panel this evening. And for those joining us for the first time, NYSNA, New York State Nurses Association, is New York State's largest union of nurses with over 42,000 members. So we're pleased to bring you to tonight's program and welcome from all parts of the world for our program, Nurses Fight Back, International Solidarity in a Global Healthcare Crisis. So we're very fortunate to be joined tonight by nurses from India, Jamaica, the Philippines, and here in the US. And I'd like to acknowledge that and give a very special thanks for those of you calling in from a different time zone. It's very early in India and early in the Philippines. So for those of you who are joining, welcome and thank you so much for joining us from all parts of the world. And we're grateful for you all for taking the time to make this very special effort to share your stories and experiences. So we know that it's been a tough year. COVID, the pandemic has really hit us all very hard. And we know that our nurses are the ones who risk and continue to risk their lives in order to provide care for patients in our communities. And while the pandemic, which still rages on in impact in different geographies and populations very, very differently, which is why it's great to have the different country representatives here tonight. We know that there are, despite all the challenges, obstacles, and struggles, incredible wins and strides that many of our nurses around the globe have accomplished. So tonight, we're going to talk about the interconnectedness of our issues, our countries, our movements, our members, and all the things that bring us closer together. So we look forward to building this global solidarity and hearing about the experiences so we can share and learn lessons together from each other. So it's fitting also this month as we celebrate International Workers' Day, typically in May. It's not as popular in the United States, sadly, but we know globally International Workers' Day happens on May 1st. So this month, it's really great to be able to celebrate together in order to continue to grow our large workers movement globally. So my pleasure to present tonight's panelists who will each have a few minutes to introduce themselves before we get together for a moderated discussion. And then we will leave time at the end for any questions that you may have to our wonderful audience out there. So please use the Q&A function at the bottom of your screen. You're on Zoom, there is a button that says Q&A. And so if you click that, you can ask questions throughout the event and we'll try to get to as many of them as we can. So with that, I'd like to introduce Rince Joseph. Actually, I realized I didn't introduce all four of the names of our panelists. I'm so excited. Let me name all of our panelists and then Rince, you'll start us off. So our four panelists this evening, we have Rince Joseph, who is a nurse from the National Working President of the United Nurses Association of India. We have Carmen Johnson, who also is a nurse and former president of the Nurses Association of Jamaica. We have Jocelyn Santos Andamo, who is the Secretary General of the International Relations Officer of Filipino Nurses United. And of course, we have Judy Sheridan Gonzalez, our NYSNA president. Judy, I know you so well, I can't even get your name right. So welcome everybody. And yes, please, Rince, start us off and let us know who you are.
Yeah. We United Nurse Association in India, we started in 2011. And we have 550,000 members and we fight for nurses' rights all these years. And we got many states, the nurses who have been struggling a lot, the pay and the crisis and all those things. And we are continuously fighting for the nurses' rights. So, this terrible pandemic came and we just we lost so many of our nurses and many of the health workers, and so the terrible days are going on. So we are still stand for nurses and the frontline health workers and for their rights and through the collective bargaining, and we we could achieve our rights. Yeah.
Thank you, Rince. So we're very happy to have the UNA here. Very fierce organization, so welcome. And
Thank
now
you.
can we have Carmen introduce yourself? Oh, you're on mute, Carmen.
Good evening, everyone, and welcome. And also thanks to the NYSNA for having us this evening. So I'm Carmen L. Johnson from the sunny island of Jamaica. I'm a member of the Nurses Association of Jamaica. We are not as large as the other unions, but we were formed in 1946, July 19th to be exact. And so we are approximately 75 years old. We represent our nurses, registered nurses on the island of Jamaica. We negotiate and we look at the socioeconomic welfare of our members. And we also seek to have that caring and relationship with nurses across the country, not just registered nurses, but we also have midwives, enrolled assistant nurses who are also some of our members. And so all in all, we are the voice of our nurses. We are the advocacy body for nurses. Thank you.
Thank you, Carmen. And Jocelyn.
Good afternoon and good evening to our colleagues in USA and Jamaica. And good morning or magandang umaga to our colleagues in the Philippines and India. I am Jocelyn Santos Andamo. I'm the Secretary General of the Filipino Nurses United. It's a national labor association that aims to protect and advance the nurses' rights and welfare of the Filipino nurses. And we have joined many meetings and activities with several nurse unions and associations in the past. And I would like to thank the New York State Nurses Association for giving us the opportunity to share what is going on, especially at this time of pandemic back here in the Philippines. And I hope that this could strengthen our solidarity with all the nurses all over the world so that we can advance our fight towards the better work conditions of nurses in all over the world. Thank you.
Thank you, Jocelyn. And Judy.
Yes, hello and welcome to our US Zoom here, everybody. I'm so honored to be in the presence of such amazing leaders. And it is very exciting to be able to share in this way that we can. Nurses have always had a universal connection, but I think with the pandemic, how we were so victimized by it and how we fought so hard for our patients and continue to fight for our patients and for our own colleagues, it's really brought us together in a much more visceral way than ever before. So really want to welcome you all. NYSNA has over 40,000 members in the state of New York. We try to fight not only for nurses, but for patients and for all our communities, and to fight against what we see as the savage inequities in our healthcare system. The incredible contradictions to be in the wealthiest country in the world, but have an impoverished healthcare system where people don't get really good quality care, particularly people of color, immigrants, people who live in certain areas, people who are the underserved. The savage inequities of our system were so ravaging in our communities, as we saw during COVID. It really crystallized it. So, you know, totally inexcusable. And we hope that those contradictions will help us to build a movement for social justice in a way that really has meaning. And I know that all of you are also committed to that. And I know that Rince and I have been through a lot together. And I'm just so happy to see that you're alive and okay. But we worry when we don't hear from you. And I'm looking forward to meeting the other two colleagues and seeing what we can do today.
If it's okay, can we just take a minute of a moment of silence to honor all of the nurses that can't be with us, just to have them with us. Okay. So thank you again. So glad to have each of you here. And so we'll start the moderated portion of our webinar today, and start with you, Rin. So, up until a few weeks ago, India was kind of shown as one of the countries that was faring better than other countries, other developing countries had. And so now with a new variant that has emerged, we're seeing a total opposite. It's a horrific health crisis that India is in right now. A few months ago, the Indian Prime Minister, Narendra Modi, had been bragging about how well India had been doing, but at the same time has also helped to privatize and cut back some of the funding for the public health system in India. Can you tell us a little bit more about this?
Yeah, sure. You're right. In the initial stage, when the first wave was come, so we don't know that nobody was not know as just like everywhere. We are not prepared in anything, and it's mainly it affected in the urban areas. So after the effect, after the lockdown, we could at least manage. I could say that in a good level. It's not really very well, but at least we could manage in a way in the first wave. But unfortunately, what happened a couple of weeks ago, see, the community-wise, the specified, the task force, I could accept that, they failed to educate the people to avoid the gatherings and the social rallies. And there are a lot of political campaignings and the state elections, election rallies, the political, this thing. And so many events were happen, and the authorities and, they are not really taken that much care. That's the reason I think so, because there are a lot of debates are going on. What is the reason behind this sudden surge in the numbers? All of a sudden, in the capital of India, Delhi, there was a acute shortage of oxygen. There are a lot of people are rushing to the hospital, because see, naturally, the normal 14 was fine, and there was a sufficient oxygen supply was there. But all of a sudden, there are a lot of drastic increase in the patient numbers, and almost 90% patients require oxygen, and many hospitals run out of the oxygen supply, and a lot of things, the total system was collapsed. So that was the case, because all of a sudden the surge came, nobody was forecast. So that was the gap between the uh, that's the reason behind the sudden surge in this, that I could understand from the lot of experts are debating about this. The different variant was there, and that variant, this variant. But I'm telling you, as from the nursing point of view, we could see the people are just coming in, and they are really breathless, and they're really sick, they're crying, and they need help. The lot of people are end up with the ICU, and there is an acute shortage of ventilators, and these are all the crises all of a sudden came. I'm not blaming any leader, because nobody can suddenly do something, and everyone was helpless. And what are the facilities available, and people have managed. Unfortunately, many of people have died because of oxygen shortage. So that was really unfortunate, happen in anywhere in the world. But what to do, in the capital itself has happened. And the reason behind that, I could say, from the first wave, from the experience, we should analyze, and we should understand the cause, and we must have focus on the community wise in the village and everywhere. Because since the first wave was attacking the urbans, the second was went deeply into the rural areas and the villages, the people was got affected. So these things we should forecast priorly, and we must have identify the people have symptoms, and we should isolate them or treat them, so we could have prevent this anyway. Unfortunately, they happen, and now the things are getting better these days. Couple of weeks it was very terrible everywhere, and the different states. Every politicians and the political people, they wanted to politicize for their this thing, but unfortunately the ultimately the people are suffering, that's the thing everywhere. The politician, they want to make them blame of the ruling party making the opposition, they're not cooperated, and the opposition is blaming the ruling, you're doing wrong thing and all this. Ultimately the people are suffering, and I could say end of the day, the nurses are the front line, and the healthcare workers. We are facing such a terrible situation. Can you just imagine somebody just dying? There is a shortage of oxygen, and we just hands up, and we are just helpless. And this is a terrible situation. We could, it was happened. Unfortunately, it's happened. And anyway, nowadays, after this surge, the people are the authorities and the medicals, the healthcare system is just tighten up, and now there is a lockdown in the different states where the districts have the positivity was high, and they put lockdown in the local area because compared from the last year was the end the country was locked down, and respectively for any reason. And this time, anyway, they manage in different sections. Hopefully, we're coming better these days, and let's hope for the best. And this was the reason behind the couple of months ago, our Prime Minister was saying the international platform. If you say that 1.3 billion population in India, compared to other developing countries, and it was not really that affected in India, and where the vaccination was, things are happening in India, and the vaccine was produced in a huge in India, and we exported to the many countries, and all these things we've done. But unfortunately, the sudden surge of the second wave hit. Nobody could identify forecast, priorly, and what to do. That's a situation, and unfortunately, there are a lot of nurses we lost their, life, and many of the nurses working with the PPE for long hours, and they have to take care of the patients, and when they go back to their homes, they have to take care of their own children, and there is no babysitting, or crutches were closed, and the nurses are finding a lot of difficulties in these days. There's no place to, because many of the metropolitan cities, the nurses are working, it's like a nuclear family. They don't have anybody to support there. The only thing is they come to the hospital, they have a crutch and leave their babies over there. Because of this pandemic, that was one of the main problems the nurses were suffering. And once they go back to their home, and they have to take care of their parents because they are sick as well. And many of the nurses, they go themselves COVID positive, and they are struggling to get admitted in the hospitals. And there was shortage of beds, and even the high bureaucrats and the high level people were struggling to get their bed, because it was everywhere full. That was a condition a couple of weeks back. Anyway, now the things are getting better, and let's see. There are so many measures are taken up, and internationally, many countries extended their support, especially in United States and all other countries in UK. We're getting a lot of things like oxygen concentrators and ventilators, and so many supporting things. Really appreciate recently the American government was taken off this. I don't know how far the things are going about the patency of the vaccines. Things are getting better. I think the people are, coming back to the normal. So this is the reason behind I could say, the sudden hit and the surge in the numbers this time in the couple of weeks back. Yes.
Thank you for that, Rince. I think that when we think about this pandemic, first wave, second wave, hitting globally, the export of resources, but then the lack of preparation to ensure that your infrastructure is ready for it, right? And like you said, India is 1,380,000,000, like that's a very densely populated nation, and ensuring that the infrastructure is there before you start exporting your resources is important. And we even saw that, I'm sure Judy will talk about it later. We saw that some of that here, the politicization, and then the people are the ones that really suffer the most. Let's turn to Carmen. So tell us a little bit, we're going from 1.3 billion to, I looked it up, 2.9 million in the island of Jamaica. What was the experience like? How, an island has its challenges, but maybe some of its advantages. Can you tell us how COVID hit and impacted Jamaica, and what maybe was particularly challenging for you and your membership, and how did you overcome it?
Thank you, Candice. So as you said, Jamaica is a populace of 2.97 million persons, very minuscule compared to my other colleagues. We had our first case on the 10th of March, 2020. And having heard that that case entered the shores, then it triggers off panic within the healthcare system and the environment. Many persons may not be aware, we are almost likely where our healthcare system has been underfunded, being in a reduced fiscal space where you have the competition for the money for funding to fund the various ministries. Health was one of those that have not been adequately funded for many years. And so the challenges arose. So we haven't had the first case. The country went into a mode of lockdowns where borders were closed to some countries. We had schools closing, we had workplace, work from home, and we had age groups where they said that person 70 and over should stay home and work from home or shouldn't come out. And so we had our early lockdown periods. Within our context, we had 24 government-funded hospitals. Our challenges were that we had less than 50% had isolation areas of these hospitals. And we had less than 50 ICU beds to treat with patients. And we also had less than 5,000 nurses in order to take care of the present populace who are ill and now to treat with a pandemic. And at the given time in 2000, our airports had no functional temperature monitoring system. And so having had that and had the first case, not knowing what the COVID virus was, not having enough information, we're listening to social media, we're listening to CDC, we're listening to PAHO, we're listening to MOHW, the Ministry of Health and Wellness. Persons had gotten confused at that given point in time. And so what was happening within the healthcare industry was that our nurses went into a mode of panic. And so in a given day, we'd have had a number of calls from a number of facilities or the mainstream media to say that our nurses are complaining that they weren't trained for this. We are not prepared for this. And once the cases started increasing and started going into the institutions, then our nurses start complaining that they are exposed. And so our biggest challenge at that point in time was to educate our nurses and to seek to stabilize the healthcare environment of itself, to ensure that we were not sending the wrong signal out to the populace to have that greater panic, and that we were getting ourselves prepared to manage the caseload. So from our first case on the 10th of March to now, we have had 47,396 cases, and we have had 863 deaths. Again, that may be comparable, though your numbers are in the millions or billions, but it is comparable to your numbers when you look at ratios. And so one of our greatest challenge was when the patients started going to the hospitals. Because in the first instance, what worked for us was that the country had their periods of lockdown, periods of curfew, and the government opened government operated quarantine centers. So persons coming in through our airports and seaports were quarantined at government facilities. And in the context of community where we had the community spread, persons were quarantined either within that community or in a government facility. So that worked very well for us to contain the numbers then. Like India, we too had a political situation where we had an election was called while we were experiencing the pandemic. And so after the election and after Christmas also, our numbers started going up because you had persons going out to enjoy themselves to support their various leaders. And so we end up with that potential spread, which in the long run boom into our first wave. And so the challenge was now, where do we put these patients, having not had enough isolation areas? And so we went into a mode where we had to repurpose wards. So you had to turn some of your medical wards or your surgical wards into isolation area. That next comes with its own challenges. We are having to reduce your working capacity to monitor and to house the patients who have their regular illnesses. You are now having backing up in our accident and emergency department for those patients who are waiting on a bed space. But nevertheless, most of the facilities who didn't have an isolation area, the Ministry of Health and Wellness and the regional health authorities got on board and they started to create isolation spaces. What we had said to our nurses was that where you don't have an isolation ward or isolation area, just look at the most appropriate area that you can find in order to cordon off and to house your patients there. One of the biggest challenge after having that was the discrimination that our nurses face. And the discrimination was both at the facility level in the healthcare institution and at the community level. So we got up one morning and the headline was fearful taxi drivers. Taxi drivers are fearful to transport nurses to work. And so you had nurses who had to be walking home from work or walking to work or unable to get to work. And so then we now had to go on our campaign where we now started to advocate and we had to use the media. The media has been very accommodating and supportive of all of what we have had to do. And so we now had to speak publicly about it and to ask persons to be supportive of our nurses. Because again, our nurses were experiencing discrimination on the job, discrimination on the road, and also at home. So many of our nurses will tell her that we can't go home, or I can't tell my relative that we were nursing COVID patients because the family member tell, if you nurse them, don't come home. Or they say to them, don't nurse any when you go to the facility. And so our nurses were in a state of confusion. What do we do now? And so we had to use the media to kind of stabilize the populace and to get that support for our nurses. The good thing about that is that for some of the areas in our negotiation that we had ended about a year or a year and a half before, we had negotiated for some buses. So we're expecting for 30-seater poster bus and a 15-seater bus. And so at that given point in time, we had to touch base with our ministries and say, hey, we need the buses now, because now is the time when our nurses are on the roads late at night, not having anything to take them home. The facilities are not providing transportation. And so those came through, and corporate Jamaica themselves look at areas within which they operate and also donated or loaned buses to transport the nurses. So we're able to take care of that. The worst part was when our first colleague came down with COVID. And so persons again now started to complain because we had no N95 mask in many of our facilities, and they have had to do the aerosolization procedures. And so persons again, nurses again went into another state of panic because, hey, our colleagues now have it. We don't have the required PPE that we need to have, and you're asking us to care for these nurses. Again, our nurses insist that we now need to open negotiation in the middle of a pandemic. And so that was our biggest challenge as an association and as a body, where we now have to stabilize the nurses, let rationality prevail, and at the same time support our nurses to cope. Having gotten through that, our nurses get into a mode of feeling much more relaxed, because we said to our in-service education officers or infection control nurses, start your education at the facility level. Take it to the ward and the unit level so that persons can start feeling comfortable and understanding how to protect themselves. We spoke out and we asked to ensure that all areas have their PPEs and that we're not left exposed. Corporate Jamaica also rallied with us and the regions and the Ministry of Health. And having done that, many of our nurses now settled into that mode of, let us see what we can do and let us assist our country. Again, we had a short staff of nurses because our nurses were continuing to migrate to the other countries who were taking them. And so we have a younger populace, inexperienced populace, to function within a pandemic and to also care for the rest of the population, and to create a greater challenge for the few senior nurses that we have in order for them to stabilize the shift. But we are much better now. We have had our first wave. The numbers went up where we didn't have enough bed space to nurse them. We had to be making bed spaces where we least think that we were able to do so. We had our oxygen challenge like India, but it wasn't as bad. And I remember hearing our patients saying, we can't breathe, and you have to be pulling and moving oxygen from one place to the next to ensure. But we overcame that within a couple of days. And presently what we're seeing is that our numbers are now reducing, where we're having less persons coming in with COVID, less persons being very ill. And the populace is now understanding. I think we have now had some COVID fatigue, though you had the cooperation of the populace within the first instance, where they were obedient to the lockdowns, they were obedient to the mask wearing, the physical distancing. They have gotten a little bit uncomfortable with it for this long. But all in all, we still have some cooperation and things are working, and our numbers are now decreasing. So we are coping much better, but the death toll have had a toll on our nurses where it doesn't cope well because of the bad outcomes that we have had. And so we have had to have psychological interventions for nurses and for healthcare workers to assist them in coping. Thank you.
Thank you, Carmen. You're describing the great lengths that nurses have to stretch and twist and turn to accommodate impossible conditions inside the walls of a hospital. And your story of what's happening outside of the hospital and the lack of isolation on the inside, but then this notion of isolating the nurses on the outside who are just trying to get to work. It's very powerful to hear how you were able to push to get those buses together. So thank you for sharing that, Carmen. Yeah, some of the numbers. So, right, the population that each of them mentioned, 25 million total cases in India of a 1.38 billion population. Jamaica, I looked up, it's 47,000 total cases, roughly, with a population of 2.9 million. Now let's turn to the Philippines, which has a population of 109 million and has seen 1.1 million cases. So we'll go to another set of islands. So we understand that in the Southeast Asia, the Philippines ranks as #1 leading with the COVID pandemic, with the highest daily confirmed cases. And we recognize that some of this does have something to do with how a government responds. So I think each of you mentioned like the lockdown being a solution, social distancing. I'm thinking about how in India and the Philippines are very, very densely populated communities. How do you social distance? Is it realistic? So yeah, how has it been in the Philippines, Jocelyn? What can you share of what your union and your members have faced, the challenges similarly, and how you've been able to tackle that?
Yeah, I am hearing from our colleagues from India and Jamaica. We have some similarities also, and our healthcare system are really unprepared for this kind of national health calamity. So when the Philippines had the first COVID-19 case on January 30, 2020, our nurses were also terrified, seeing at that time the world scrambling to fully understand the etiology of this fatal and highly contagious disease, COVID-19. And like mentioned by our colleagues, that our country has really lacked many things like mandatory tests, life-saving equipment, supplies, medicines for our patients and communities. And of course, the health workers and the nurses lack the adequate protection they need so that they will not be infected and get sick and die of COVID-19. And despite all this, the inadequacies on the first days of the pandemic, the Philippine Department of Health even boasted of a robust healthcare system, claiming that our country belongs to a middle-income country classification, and hence we don't fall under the category of poor healthcare system. But obviously, the government has failed in many ways. It has fallen short in the needed mass testing, contact tracing, isolation, and treatment. And so our cases just keep on increasing. And just very recently, this March, we had another surge. In fact, yeah, like you mentioned, the Philippines was #1 in Southeast Asia with the highest daily confirmed cases. What is shocking is that the first 500,000 cases occurred from February of last year to February of this year, and the next 500,000 cases occurred only for 1 month, this March to April of this year. And these are not simply number of cases of death. Of course, behind these numbers are millions of lives affected and deeply scarred. And up to now, we still continue to lose our colleagues, friends, and relatives, and hearing stories of people being turned away from 5 to 10 hospitals before they can get admitted, if at all. And meanwhile, the COVID-19 cases among Filipino health workers is 13% of the total cases. compared to 2 to 3% in other countries. And as of May 2, 2021, there have been more than 17,000 health workers infected, with the nurses always on the top of the list. There have been 6,387 infected nurses and at least 25 deaths from the nurses. And this trend, of course, has been alarming. And what has been the continuing government response? What is very silly amidst the clamor of the public to have a clear plan and action, the government even issued a directive to government agencies to convey to the public that Philippines is faring better than many other countries in addressing the pandemic. But it cannot belie the fact that the national COVID-19 response has been miserably falling short in these public health measures to control the pandemic. And it's still raging up to now. And we have at the moment the problem of a very slow vaccine rollout or the mass vaccination. As of May 14, only less than 1% or 0.35% of the government's target, 70% of the population has been fully vaccinated. And only almost half of health workers have been vaccinated with the first dose. So with this pace, we can possibly achieve herd immunity in 3 to 5 years. And they say that we have the longest lockdown in the world. So we believe that militaristic approach such as this would never resolve the pandemic without the clear coordinated plans for the health workers, clear and scientific COVID-19 response, and without the adequate immediate economic assistance for the marginalized sectors. And we always say that the inadequately funded and fragmented healthcare system will inevitably burden the already abused and exploited healthcare workers like the nurses, especially now, especially during this pandemic. And despite the extreme sacrifice of the nurses putting their lives online pre-pandemic and still currently the Filipino nurses receive the lowest pay in Southeast Asia. While those in public sector receive an average of roughly $650 per month, the nurses in private sector get an average of 10,000 pesos per month, or that is equivalent to $200 per month. And although we were happy last year that there was an upgrade in the entry salary of the government nurses, the memorandum of the government comes with a provision that subjected thousands of senior government nurses to demotion in rank in the midst of this pandemic. So you see, when FNU was formed in 2015, this was precisely what we want to confront, the critical issues of low wages, poor work conditions, and besetting nurses that with this pandemic, these have become worse and more exploitative because we go on duty for very longer hours, averaging from 12 hours per shift, sometimes extending to 16 or even 24 hours with unpaid extended hours and heavy patient load. One nurse handles 12 COVID patients, and that is way beyond the safe nurse-patient ratio. And we know that it has been years that the Philippines has been the #1 exporter of nurses to the world because of these very poor work conditions, very low pay, and of course the worsening economic conditions. So we continue to fight for the rights of the nurses, and we have won small victories. And of course, although the government keeps telling us that nurses and health workers are heroes, we continue to be neglected, abused, and exploited. And so we have no choice but to fight back through many ways, no, in the local level and also on the national level. And to cite example like our members in an infectious hospital, the San Lazaro Hospital, they brought out the clinical shoes. This was inspired by the action of the National Nurses United to symbolize our protest with the continuing inadequacy or absence of N95 masks. And then the next day, they were given 4,000 masks by the Department of Health. We also held a sit-down protest in the National Children's Hospital where they were not given the retroactive pay for their raise, and it helped stop the demotion of the junior nurses. So we continue up to the moment, we continue to demand the mass hiring with regular plantilla positions to address the problem of understaffing. And of course, we have to be vigilant together with the people in asserting the right to the free comprehensive health care. And we say that no matter how long and painstaking it takes, organizing nurses is the only way we can effectively address this issue of just wages, abuse, and violation of rights. Organizing and unionizing towards change in our profession, health sector, and in our society so that the people can truly enjoy their right to health. And we say that we should contribute to the efforts towards the genuine societal change where health is a priority as a service and not a commodity for profit. And of course, we want change not only for ourselves, but most of all for our patients and our communities. So in behalf of the Filipino Nurses United, we salute all nurses in the world and let us carry on with the struggle for genuine change in solidarity with nurses and all peoples of the world. Mabuhay.
Thank you, Jocelyn. Yeah, I think you covered a lot of things and connecting with everything that's happening in the other countries. I'm excited to bring Judy on because you raised some things. We saw globally that Filipino nurses, as you said, if the wages are so low in the country, then of course they're going to go elsewhere. And we have many immigrant nurses here in the United States, but we did see that there was a disparity, right? Many, the ratio of Filipino nurses that ended up dying from the COVID crisis was oddly skewed to be more Filipino nurses than other populations of nurses. So yes, let's continue the struggle. Judy, someone that I get to see more often than other representatives. We were in the battle for safety for our nurses in the Bronx. It was a very fierce battle. Can you tell us some of the things that all of our panelists have said kind of resonate? Oddly enough, being in this incredible nation with resources. Can you tell us what, we were hit very hard in New York, right? It's the epicenter of the epicenter of the epicenter in the Bronx. And so can you reflect or share a reflection of how things could have been handled differently? And and if there are some ways that this was actually a tragedy waiting to happen. Vince talked about like the politicization, and we saw that heavy with our former president. So yeah, Judy, please, welcome.
Sure. Thank you also for these very enlightening presentations. I see we share a lot of similarities, mostly that our frontline caregivers were really sitting ducks to get infected with this virus. And the percentage in the United States of healthcare workers who were infected and died from COVID ranged from 7% to 26% of healthcare workers. It was brutal in New York. New York City was the epicenter way back in March of last year. And in the Bronx, where Candace and I work, and where I live, was the epicenter of the epicenter. We had so many bodies. We had people walking in and 3 hours later dying. There were so many dead patients so quickly that they had to get trailers to serve as morgues in our garages. And there were so many bodies being wrapped out, sometimes 30, 40 a day. We had to double our spaces to take on these patients. And what we realized, even prior to the hitting the pandemic, as nurses, of course, we look at what goes on in the rest of the world. We saw what happened in Wuhan, and we saw what happened in Italy. And we talked to our colleagues in those countries, and we were very concerned, but not our hospitals, not the regulatory agencies, not the CDC, certainly not the government of the incompetent administration that we were dealing with at the time. Nobody did anything. And then we were the ones who were victimized by it, and so were our communities. And our communities that are poor communities, our communities of color, it was just people were dropping like flies. It was so devastating that many of us haven't even processed that two and a half month period of constant death. Also, there was not that much known about treatment for COVID at the time, and people were just desperate trying to figure out what to do. People were getting so sick. In the emergency room where I work, 80% of our staff got COVID. 80% of the staff got COVID. Some people have not been back to work. Many people left the profession out of fear. Older nurses retired early if they could, and other people just left the profession. So it's really decimated nursing in this area. Then we had this kind of hiatus that went down. But let me get to the point first, because we had to fight for PPE. There was no, they were denying that it was airborne. That was the first lie. They denied that ventilation was an issue. And when I listened to a very early podcast from by a physician, an epidemiologist, he had said, well, I'm not political, but I'll just say this. It's a lot cheaper for the government to tell you to wash your hands and keep distance from people than it is to provide you with masks, because they knew that we needed those N95 masks or the elastomerics or whatever those masks were that were going to keep out these tiny micron virus particles. And so many of us got sick in the beginning that it was just, we were taking care of each other at home. And I think, as you all said, when you're, donning and doffing uniforms and garb, coming home, being afraid to infect your families. Many of us lived in garages and cars and tried to get hotel rooms so we wouldn't infect our families, because there was so much fear, terrible fear in the beginning about what we could transmit to the people that we cared about. So we had big fights. We got out there and rallied, and we had demonstrations, we had petitions, we had very militant demonstrations about the responsibility of the government to take care of its population. Our healthcare system in the United States is very rich. It's about it's some huge percentage of the GDP. It approaches 20%, maybe it's more, I can't remember the figures. Right now, just if you're interested in figures, we have a population of, in the country, we have 33 million have been infected, 600,000 dead in the United States. Our population is about 330 million people in the United States. 300,000 healthcare workers are infected. And as I said, up to 26% in some cases. In terms of vaccination, because of the mistrust of the government and all this conspiracy theory that was promulgated by the prior president, we have many people who have not been vaccinated in the highest risk areas in some cases. Some are just right-wing conspiracy theorists, but there are many people that have righteous concern about not trusting the government, not trusting pharmaceutical companies. But, at this point, many of us are saying, let's really get vaccinated. We know it's the only way to develop herd immunity and deal with the virus and all the variants. But we are having a lot of resistance in some of our poorest communities to the vaccine. There's resistance to everything because there's such an ambience of mistrust and conspiracy theory in this country right now that was really put forward by the last administration. I'm sure you're all aware of the vote, the election, the takeover of the Capitol. I mean, it's a crazy situation we have here. So there's just there's big polarization in our country right now, which also interferes with being able to do things that are socially important. So we don't have a collective mentality in this country. We never did really. There was always this kind of rugged individualist mentality. In other countries, I think people much more bond together and feel more homogeneous. But right now, it's there's no sense of the collective in many places. People are just really very focused on themselves. And as healthcare workers, and certainly as a union, we've really tried to address these issues around the social determinants of health, as so many of our communities are so marginalized. The deaths of healthcare workers largely were people of color. Black and brown people are dying at twice the rate, both as among healthcare workers and among essential workers, way higher, and certainly among our population. So it really laid bare these savage inequities that exist in our healthcare system, and trying to raise consciousness in our own organization about that has also been very, very challenging, because people who live in different realities, who have certain privileges, whether through wealth, whether through race, whether through ethnicity, very often are not conscious of what that's like for others. So all these things have converged in this last year. It's been very difficult to try to get people around a common thread. And I highly recommend a movie, a documentary that illustrates, called Totally Under Control. It's a documentary, and our nurses at our hospital, Candace, are featured in that movie. It was in the short list for Academy Award. We were excited about it, but it didn't make it. But our protests and our advocacy for our patients showed one side of this country, and the president and his crazy cabinet of people who were in denial for so long that there was a problem are featured, and how that was so mismanaged. Our healthcare system, our general economic system, the culture of the country, and people not really caring for one another, which I don't think is a natural way for people to be, but that's been pushed, this kind of, take care of yourself. There's the other, there's the xenophobia, there's the racism, there's the white supremacy. There's all these contradictions in our society right now that keep people divided. And there's such a tiny percentage of people that are benefiting from it, but so many of us vote against our own interests, have perspectives that violate what we really need. These are the educational needs of our population that we try to take on also as an organization, through healthcare, through the things that we understand, through the fact that so many people are uninsured in the richest country in the world. So many people are underinsured in the richest country in the world, that we don't have a national healthcare system, that we don't, very recently we had a victory in the state of New York of getting certain supports for PPE called the HERO Act. We just got our very first staffing bill ever, which has a lot of complicated pieces to make it happen. But, it's through the struggles of nurses and through the struggles of healthcare workers that laid bare these contradictions, getting compensation. People were getting sick at work and were being denied the compensation that they deserve, called workers' compensation, for people who get sick on the job. And there's so many roadblocks for people to have to breach in order to get the care that they need in order to care for our patients. So it's similar to what is going on in the world, but the contradiction is so obscene because of the wealth in this nation. And I apologize for my country being a brain drain for all of your wonderful nurses who come here, and not my fault, but we benefit from their presence. They're amazing nurses. We work, so many come to the Bronx, but I know that does harm to the country that they come from, because the conditions are so difficult. And we cannot deal with this situation if we don't have a global understanding that we all have to take care of each other. Something that happens in the Philippines or in Jamaica or in India, it affects us here. And even if it didn't, it should matter. So this is a great forum for us all to come together and understand that we're all sisters and brothers in this world, and that one of us falls, all of us fall.
Thank you, Judy. That's actually something I want to talk about, and a question for the group. I welcome each of the panelists to speak to each other, and then we have a couple of questions from the audience that we hopefully will get to, if the time permits. I do want to say that this is an initiative that we'd like to see other series. I think we picked Jamaica and India and the Philippines as countries that have large populations of nurses here. So yeah, hopefully this won't be the last conversation that we have. And so a question I'd like to pose to the group is aligned with what Judy said, and rings through to each of the panelists talking about the healthcare systems in your countries. When we think about international solidarity, and this virus being global, something that we all shared, you shared similar experiences, different, but similar in the challenges that you faced as nurses, and our communities faced with this pandemic. If the virus is global, do you think, what do you think our global response should be, or is there a way for us to connect better, to have this solidarity have an impact? I actually want to turn to a question that is in the chat that's sort of related. How do we prepare better? What are the lessons?
Not hearing you, Candice.
I think maybe it looks like Candace is having a little bit of trouble, but I think she mostly asked her question around the global pandemic and a global response, and how are we prepared for the next inevitable pandemic? So if Vince, you'd like to start, and yeah, and then anyone who'd like to continue on.
Right. Well, this is something new, the virus, and this all the experience for everywhere in the world, for the nurses and all the governments and everything. So what's in my point of view as a global nurses, we must have some communication with each other. So we must have an understanding, because the thing is, we were talking about when it started in Wuhan, and after that it went to Italy, and it was a very bad hit. And after that, in United States and many other countries, in the France, and it was spreading everywhere. But when the things were started in Wuhan, the other countries and the people are, not really care about it. Okay, fine, it's somewhere, something is happening, something like that. Then it's come to the Middle East and Saudi Arabia or somewhere it was detected. And even then, the Europe and the other countries were not really careful, or when it was happening. I remember the death rate, and they're crossing about thousands in a day in Italy. Then that's the time the people are really scared about, and they started thinking about this virus can come in my country. This can that's a situation. But learning from the question was asked, learning from our lessons, this is our new experience. We must understand the things will happen in anywhere in the world. There is a possibility that things can happen in my country, in my home, that's a things, that's a take home, that the experience we need to know. And we have a global platform like this, and I really appreciate NYSNA to organize such a things like that. We communicate each other. We must have regular meetings, not only in this only particular for this pandemic. Every time we must have regular meetings, and we must share our sufferings and struggles each other. Like I could say, like if we could have taken some kind of, we could shake the government before these things comes in our footstep, we could have managed it much more better than this. Definitely, when the things was badly happening in Italy, we, the nurses unions, globally, we must have right to WHO or something. We must have collectively some memorandum to all nations, or something like that. We could have done, at least something we could have done it, because we are the nurses. We are hearing from even the doctors that come and go, and we, the nurses, are with the patient for 24/7. So we know what are the variants is happening in the first wave, what happened in Italy, and the second wave in Italy, what was the different experience, and what was the first experience in India, and second experience in India and United States, and so many countries. And at this point of time, I could say, and what all happened is happened, but in next, the people are, the experts are telling the third wave is coming. At least we must have to prepare for the third wave. Okay, what are the community systems, the identification, what are the precautions to be taken, what are the education to be done in the community wide, all these things. We have a role, we have a very important role, and we should not just wait the third waves to come and the people are rushed to the hospital, and there is a shortage of oxygen, and there's shortage of bed, and we must have to act priorly. We must discuss what are the challenges we faced in each country with the different variants. the experts are named UK variant, Indian variant, Chinese, this variant, that variant. So what are the struggles and what are the symptoms, especially because nowadays nobody was known. There is no, there are so many uncertainty about this virus. There is, people are keep on changing their strategies like treatment. Someday they are saying that Redmissor injection is good for this virus, and the very next day they're saying the Redmissor is not good, and you can give some hydrocortisone and this and that thing. There's also a lot of uncertainty, and people doesn't know, and even the vaccination things will happen. There is another challenge. People doesn't know which one is to choose. There is a one sort of vaccine for this Sputnik, and this is Covishield, Covaxin. It's all the things is confusing the public. As a common man, it's getting public. Where should I go, and what vaccine I should get? And this is good, and that is what. And people are, worried about their health. The health is a human right, the WHO says, but every individual is worried about their health, I'm sure. And no matter how much money they spend, they want to get the best, the good vaccine, get immunized and all these things. But unfortunately, there are a lot of uncertainties and the treatment modalities and everything. There was no proper guideline. Even the whole system is at stake, I could say. The very rich country and the well infrastructure country like United States got hit like very badly. And just imagine like 1.3 billion dense population like in India. What will be, can you imagine what is going to happen? So we must learn from these experience. I could say we should not wait for the third wave to come. Let's see what we're going to do. No, we must share our experience each other, and from different countries, and collectively we pull. And where are the guidelines the people are preparing, like in a WHO, and we must have right to the labor organization, ILO. They're also responsible for that. They're not just like international labor organization. They also have the their important role to play
global
in this.
Organizations, right?
Yes. So we must get things collectively, and we must share our ideas on what we can do, and respectively we can share to our government authorities, and globally at least we could contribute something to prevent some for the next coming waves, how to prevent. And this is my one suggestion. And other thing.
Rin, sorry, I just want to, at least because I know we're running short on time, here if Jocelyn and Carmen or Judy would like to also share their input as well. Sure. So we could probably do this forum for hours, but unfortunately we'll have to start getting to the next. Yes,
I want to concur with Rin's, because one of the things we should have now recognized based on this pandemic is how fragile globalization has made our economies and our countries. And that we must recognize that health is not a direct good. It is a good indirectly, because if I don't take care of my health, it is going to affect the next person or the next country. And if you take care of yours, then it will impact how we survive and how we manage. And so I think we need to have consensus and solidarity around how we share our resources. India, for instance, has advanced medical research capability. How do we share that medical research capability? How do we get other countries who are not so advanced to participate? And how do we share the information that we are gathering and to ensure that we are giving correct information to get rid of some of the panic and to help persons to understand how to move on? How do we build consensus around healthcare challenges, and how do we say to them, let's share our experiences as to how we contain and how we treat COVID-19? Because whether or not we know it, as day follows night, and as wake follows sleep, we are going to have something else coming before our lifetime ends. And so how do we share how our experience as to how we contain and how we treat it, and be truthful about it, so that the other countries can learn from it, and that countries can benefit. How do we share how our governance within our healthcare system operates to ensure that the person without health insurance, the person who doesn't have a salary, that he or she has entitlement to the best healthcare system that there is, and that they can access healthcare that really meets their needs and what they demand at the given point in time. How do we say to countries, when you are going through it, don't shut down on the rest of the world while you quietly treat with what is happening within your sphere, but how do you say to the others, this is what we're doing, prepare for what is to come, and this is how you can prepare for it. Again, we look at it where countries, because they were going through it, they decide that we'll close the borders to export of PPEs, to close the borders to medication that can come. And so we are seeing it as a direct good for myself, but not for the other countries who barely can manage or who really want to have it to save some lives. And what we must recognize is that COVID shows us that the lives are leveled at the ground space. It takes anybody, no matter your status, no matter your educational level, it affects every person in the same regard. We die in the same regard, we get sick, we end up at the same places. And one thing I've come to recognize is that a country like mine, when persons get sick because they have money, they'll come to you in New York or go to Miami. You could not accommodate them this time, so they had to stay within our sphere to be treated. And so how do we ensure that, learning from COVID, we get our healthcare system to a level where it is able to function and that we are not trying to cope when something hits us big. And so we should be able to share our knowledge, share our resources. And as Rin says, we should be able to have that international platform. Yes, we know the International Council of Nurses exists, and they were trying to see how they put countries together and how they get the information out. But how do we, within the pandemic, while we are going through it, speak to each other?
Thank you, Carmen, for highlighting how globalization is seeming to fail us globally. It's not such a friend of all of our countries, right? So Jocelyn, do you want to share? And then
Yeah, I agree with what they said, and I would like to add that we should always keep updated on what is going on with the issues with the different countries. And maybe as one, we can ask our governments to prioritize health and respect our right to health, the people's basic and other basic human rights. And one problem we are encountering now is the vaccine accessibility or equity. That's why we have joined the campaign, the World Campaign, to for the World Trade Organization to approve the waiver on the patenting or the patenting. It is actually we have started to support the government of the efforts of India and South Africa, and very recently we have heard that the U.S. government already said had a commitment in supporting this petition for the waiver on the TRIPS, or the what we call the patents. It's a trade-related intellectual property rights agreement at the World Trade Organization, so that the vaccines can be made more available to all countries, especially the poor and developing countries. So this is our we hope can be a world campaign so that the vaccine can be universally accessible to all for free at the point of care. Yeah, that's I think very immediate and very important that we can have a cooperation with.
thank you, Jocelyn. Yeah, aligned with what Carmen's saying. How do we share resources? How do we also share important information that literally heals the world? Judy, go ahead.
Yeah, I mean, I think, it's interesting. We talk about a global economy, but what that really is a global economy that benefits only the wealthy and the corporations. Necessarily, they did this so that they could super exploit, more people across the world. And we know that. So we need to kind of create some alternative to that. This issue of patents, right? I was reading about Jonas Salk, who invented the polio vaccine, or one of the inventors of the polio vaccine. And they said, well, are you going to patent your vaccine? He said, how do why would I patent a vaccine? Can you patent the sun? That was what he said. And that was that mentality that what world do we live in that there is the capability to prevent death internationally, and there are these economic roadblocks to it? How is that not a moral imperative to do something to destroy that mentality? You know, where is our morality as a world society that we allow such a situation to even occur? I just finished reading a really great book by Paul Farmer, who founded Partners in Health. I don't know if you've heard of it. It's an international agency that does that deals with illness. We worked with them after the earthquake in Haiti when we did a mission there. And he wrote a book called Fevers, Feuds, and Diamonds, The Ravages of Ebola. And he characterizes certain parts of the world, particularly in Africa, as medical deserts. People have been, you know, areas in which there are no ICUs, there are no areas in which people can be cared for. And what he found was that people died of Ebola, not because it was such a horrible disease, because there was no parenteral nutrition that was able to be handled for people. And they were basically dying from diarrhea and vomiting and total dehydration and kidney failure. But that in wealthier countries where they had ICUs, people could be cared for when they hit the disease early. And, you know, this is the kind of thing that we have to be able to look at ourselves as a world community. And one of course, the negative thing about being isolated with COVID, what came out of that was positive, is Zoom. You know, we all started having much broader ways of communicating with people in different parts of the state, in different parts of the country, and different parts of the world. And I hope that we can keep up this level of communication and understanding and interaction so that, you know, through education and interacting, we appreciate and learn about each other and move away from these narrow worlds that we tend to live in and look at this world community as our community. And that globalization or the global economy or whatever is global is something that we can own as well, not just be victimized by, because right now we're all victimized by it. And we saw this during the pandemic. And I think the communication that we've been able to have as workers, as healthcare workers, as nurses, where we find that we have so much in common, you know, that gives me hope for the world. And I think that that's what this is all about. How do we prevent disease? How do we care for our people in a way that benefits everybody? Because COVID showed us that it's not okay for one group of people to get sick, because then we all get sick. That's the interesting thing about the virus. So we should take more control of our lives and our countries so that we can have a more humane healthcare system and then a more humane society. And I think that's something that we all on this call share. And I know that our members in all of our respective countries feel that same way.
Thank you, Judy. So there's a couple of things. You referenced a movie that we should watch, Totally
Yeah.
Under Control,
Totally Under Control.
and then a book.
Yeah, it's called Fevers, Feuds, and Diamonds, The Ravages of Ebola. And not only does he talk about how healthcare deserts, but that the issue of colonialism and European domination of Asia, Latin America, and Africa generated this underdevelopment and intense poverty and the lack of development, because they were so ravaged by being gifted with natural resources that wealthier countries in Europe and then later the United States exploited, destroying nations. Very good book. I recommend it.
Appreciate that. It's something that we should all understand, right? Having a critical analysis of understanding our history, the true history, not one that is made, you know, fabricated to make the United States look good, but understand where that brain drain comes from, how the economy is impacted. Carmen talking about globalization actually really causing the economies in other countries to be weaker, and also our health systems to become weaker too. So thank you for that. And we're coming sort of to the close of our panel. We had a couple of questions. I don't know that we can answer them quickly, but I just wanted to acknowledge that there was a question about whether or not when we talk about death, Judy mentioned it earlier, you know, body bags and the trailers, like in India, the recent deaths, do you believe that the numbers are real, or do you believe that, you know, that it's actually not capturing the real number? Just a quick answer. If that's possible, Rins. You're muted also. Oh, you're muted, Rins.
Well, talking about that's like there is no specific numbers. Like there are a lot of hundreds of nurses they lost their life, and in the hospital, the patients who are admitted they got die. They have a records, and there are like in the huge numbers. And every day, like more than 4,000 people are dying in India. Last couple of weeks, so it was huge. And apart from that, there are so many people they are taking care of their home, and because of lack of oxygen they could they're dying there in their own homes. So I could say there is no specific numbers how many, like approximately more than 4,000 people are dying in a day. And the every day the positivity was more than 4 million. It was come down like recent days. It's 3 million in a day positivity rate. So anyway, it's terrible. It's still is going on. So in the state-wise, I could say like the capital, Delhi was recorded the largest death rates in the couple of weeks back, and like in Maharashtra in the northern part of India, and in the southern part of Karnataka and even Kerala also have a very bad hit in this the death rates. So especially these states started their lockdown. Hopefully, let's see that the numbers are coming down. So these are all the status.
Thank you for that. And I want to highlight again, this is a conversation that could actually go on much longer. So I wanted to just acknowledge that there still are open questions, but for the sake of time, I wanted to also highlight that Alicia had a comment in our chat that there must be emergency plans in place. Nurses and healthcare workers must be protected. Protective equipment must be a part of the norm, part of our uniform. Continue to use forums like Zoom to communicate and organize on a worldwide level. And those are all great universal things, right, that we should consider. So it's breaking my heart that I can't continue to talk. I know there's a hand raised, and there's also Shanique has put in the comments about making sure that we don't, that nurses do not offer care based on socioeconomic status. We need to caution nurses not to offer care based on socioeconomic status. We also, to the stereotyping, and it affects care, how care is given. How do we understand that healthcare is a human right? Access to the vaccine should also be a human right. If we want to make sure that we don't hit a third wave of the pandemic, we need to share resources, and we need to fight for universal care. I think that that's something that we heard from each of you. So I raised my heart again. I know that there are more questions. If you enjoyed this panel, please throw a comment in the chat. And I'm going to bring on, we have Roni Crivello and Henry Rose, that they will both be closing us out. So I'll pass the mic to Roni from NYSNA.
Thank you so much. First of all, I'd like to thank Rins, Carmen, Jocelyn, obviously our Judy Gonzalez, to accept the invitation to participate to this great webinar. I also, Anna asked me to talk a little bit about the medical missions, but being very brief, I just wanted to say that in this panel, we have people that are responsible for one of the most successful programs of NYSNA. We have Judy with the full support, the medical missions. We have Carmen, that was one of our hosts in Jamaica and with their association. We have Rins that help us so much in our medical mission. We have Jocelyn in association with the FAWA that helped us as well. So the panel is part of the medical missions and the success of the medical missions. So I thank you so much for the support. And obviously we are waiting for the right moment to go back. And I hope that happens soon. And so again, thank you so much for your support on the medical missions. And I hope to see Rins again in India sometimes, perhaps next year, if everything goes well. Jamaica, Carmen, thank you so much. Jocelyn, thank you so much. Judy, thank you.
Thank
And
you,
I
Ron.
get-
Henry.
I guess closing out falls to me. So first and foremost, just want to make sure that we give a round of applause to our wonderful panelists and let them know how very much we appreciated them in bringing their enthusiasm and their sense of purpose, their commitment to healthcare as a human right and to their patients here to this panel. And just wanted to make sure that you understood how very much this means to us. This is the third such panel that we've held, and these panels are an attempt to broaden the understanding from membership of what NYSNA can be, what kind of issues NYSNA is capable of dealing with. But it's also to enhance our vision of ourselves in society and the world, because ultimately transforming ourselves, transforming society, and transforming the world is what we must do and what we must have as our mission. Realize that this is an ongoing series of examinations of critical issues and moments and movements, and just hope that everybody as membership both pay attention to your emails, pay attention to your text, and please let us know what kind of issues you want to hear dealt with so we can do it. Thank everybody for this evening, and it's 9:29, and so I will not run my mouth for another second so that nobody can say I took us past 9:30.
Thank you, Henry. Maybe I'll take us past 9:30 because
That's on you, but not me.
I want to give, thanks, Henry. Thank you for that impassioned speech. I can't agree with you more. How do we transform society? How do we ensure that the whole world is connected to sounds a little corny, but to heal together? You want to, again, give a shout out to everyone around the world that is tuned in, especially our folks in India who are on the earlier side of the morning. And a big shout out, as Henry said, NYSNA has incredible potential and power, linking with these incredible organizations and nurses around the world. Pat Kane is on the line, Executive Director Pat Kane. Thank you for forever supporting nurses being on the front lines and really pushing the boundaries to really make a big statement. And we also have our board members on the call as well with us. So thank you so much, NYSNA, for hosting this panel, and then the incredible international panelists, Rins Joseph from, let me get the titles one last time. Rins Joseph, let me get my paper. Rins Joseph, from the National Working President of the United Nurses Association of India. Carmen Johnson, the former president of the Nurses Association of Jamaica. And Jocelyn Santos Andamo, the Secretary General and International Relations Officer of Filipino Nurses United. And of course, our own NYSNA President, Judy Sheridan Gonzalez. My name is Candace Sering. Thank you so much for allowing me to host this panel. And we wish you all a good night or a good morning. And again, we continue the struggle, we continue building solidarity, and we continue to fight for a better world for everyone. Thank you and have a good night.
Thank you.
Thank you. Thank you. Thank you.
De Alto Cedro voy para Marcané, llego a Puerto, voy para Mayarín. De Alto Cedro voy para Marcané, llego a Puerto.